What is the reason for this postural abnormality? It is not clear.
Okay, let me ask you a question. What would you consider to be some examples of significant research that has been done in this disease, ME/CFS?
Well, there have been many workers and researchers in this disease in various centres throughout the nation and basically internationally. Significant research has been done actually by Paul Cheney and Nancy Klimas into the structure and cause of this disease. Have we actually determined a causal agent? Well, we have not actually definitively defined the cause of this disease. What we've seen in Britain is that my friend Jonathan Kerr, also a Belfast man, has actually done genetic subtyping of this disease, and actually has published a paper which we actually submitted the specimens, defining actually that there are 7 abnormal genomes in patients with this disease. Jonathan actually created quite some excitement because this shows the physical attributes, possible attributes of this disease. Nancy Klimas has done signal work in cytokine abnormalities in this disease, and also showing that the natural killer cell activity is abnormal.
When you say cytokine, can you describe what that refers to specifically?
The cytokines actually are part of the immune response, and the cytokines, whilst actually we haven't seen an exact pattern in every patient, we have seen actually that there is abnormal cytokine production in this disease. What does this mean? It means actually that the immune system is dysfunctional. Why? Well, that's the $6,400,000 question. Is this dysfunction something that is innate and is related to Jonathan Kerr's genetic genome, or is this actually causal, which is caused by an infectious agent such as a virus, which has actually disturbed the immune response in these patients?
And there have been even prior to Royal Free, there are some reported outbreaks of this going at least back to the 1930s, and with the events that happened in Incline Village, and also Dr. David Bell in upstate New York, and other outbreaks. I could say that Hillary Johnson covered this in great detail in her book Osler's Web. Now, I have a question because in a few years after the Holmes criteria were published by the CDC, a group of the doctors who had dealt with this disease going back to the 1980s, Dr. Komaroff and Cheney and Peterson, they published I don't know if it was a response to the Holmes criteria, but it was their findings and their experiences in the Annals of Internal Medicine, and that was followed up by a letter that was published in a subsequent issue that was written by Bill Reeves of the CDC. Bill Reeves, who was the head of c.f.s. research at the CDC for probably around 15 years, and the events at Incline Village, I think, as much as anything else, was the phenomena that led to the creation of the term chronic fatigue syndrome.
That's correct. It's an unfortunate term because actually the chronic fatigue syndrome actually led to trivializing the disease, and soon after actually the CDC had devised this term, the national media such as Newsweek defined this as yuppie disease, a disease actually where the patients actually weren't really sick, but they actually thought actually that they were sick, and they created a great problem because we now actually are faced with a disease on which actually doctors, patients, parents, employers actually now looked at the patient as if they were imagining that they were sick and that they were perhaps malingerers. And insurance companies actually also created or took this idea to their advantage and actually did not actually pay for treatment of this disease.
Yeah, the perception was that it affected a group of A-type personality overachiever yuppies who were overworked and overstressed, and then who all of a sudden overnight became malingerers, which is very strange. Now, Dr. Reeves' reply to the Annals of Internal Medicine in 1992 stated that the events at Incline Village did not represent chronic fatigue syndrome, or, as he put it, any other known clinical entity. And some years later on ABC News on television, he dismissed what had happened there as hysteria to a reporter.
Well, this is not new. Actually, when Melvin Ramsey first described the outbreak in the Royal Free Hospital as the normal blood tests that were performed on the cohort of doctors and nurses were normal, other doctors have said, "Oh, this is hysterical. These people are hysterical, and there's nothing wrong with them." It's rather arrogant for us as doctors actually to disparage patients just because we don't understand the disease. This has been done actually many times in the past. In fact, it was done actually in the early days of the diagnosis of multiple sclerosis. In early multiple sclerosis, patients were defined as hysterical paralysis. Yeah. It's very sad, very arrogant.
It's my understanding that Stephen Strauss of the National Institutes of Health had a large role in the marginalization of this disease and the perception of it by the public and by medical science, which it's difficult to take a name like chronic fatigue syndrome seriously.
Well, the problem is that we actually don't know what causes it, and when we actually don't know the cause of the disease, or actually the real definition of the disease and how it actually can impact various subsystems, it's easy for us to actually just write it off because we don't understand it. It's sad actually that we can actually not pay attention to the patient and actually try to marginalize the disease and in turn marginalize the patient.
No, I think that's why Hillary Johnson looked to Osler as some consider him the father of modern medicine, but I believe that what she took from that was that he was a physician who advocated listening to the patient. Perhaps now we can move on to the...
Well, before we do that, I'd just actually like to say that this has been actually described in ancient times as neurasthenia, and basically Manningham actually described this in the 18th century. Florence Nightingale actually was thought to have suffered from this disease, as was Darwin when he returned from the Galapagos. Neither of these patients actually are exactly patients who we would describe as mental cases. They wanted to actually perform their work, and they actually didn't lock themselves up in their houses actually because they wanted to. It was because they were sick, and we believe that they were actually manifestations of what we know today as ME/CFS.
Right. The history is substantial. Moving on to something that has been very exciting over the last year, the publication last year in Science of the connection to the retrovirus XMRV. Tell us a little about that.
Well, let's actually reflect, starting actually from the Ramsey days of viruses and impact on this disease. Ramsey, when he actually first described his disease, post-viral fatigue, then myalgic encephalomyelitis, and then royal free disease. It was obvious actually that this multiplicity of names meant that we actually really didn't understand actually the causation of the disease. And we then looked at various viruses actually through the years. The various viruses that were implicated were Epstein-Barr virus, cytomegalo-inclusion virus, human herpes virus 6, human herpes virus 7, several other peculiar viruses, including actually a retrovirus, which was described 18 years ago by Enlander. So retroviruses are not actually a new idea in this disease. Crooks defined the disease as caused by Candida and wrote a book on the subject. Nicholson actually defined the disease as caused by mycoplasma. So there have been actually many thoughts on a single agent or agents that have caused this disease. And in October in 2009, Dr. Mikulowicz did some very exciting work on XMRV virus in Nevada in the Whitmore-Peterson Institute.
Yeah, that was done in collaboration with the Cleveland Clinic and the National Cancer Institute.
Yes, it was, indeed. And this created great excitement. And the paper was published in December of 2009. Interestingly, there was actually immediate reaction, and in December the 1st of 2009, couple of weeks after the original paper was published in Science, denial of the XMRV virus in c.f.s. was published.
All right, this has become a very, very controversial area of research, and we're going to have to delve into that in greater depth in the next segment.
Thank you very much. Hello, this is part 2. Hello, this is part 2 of our series on ME/CFS, myalgic encephalomyelitis chronic fatigue syndrome. My name is Derek Enlander. I'm a physician in practice in Manhattan, New York, and I'm being interviewed by research assistant Jay Spero. Jay is very modest and has decided actually not to appear on camera, much to my dismay.
I ask better questions from over here.
We actually started actually to talk about XMRV at the conclusion of the last segment, and we actually decided actually that this would be a good morsel of excitement in which to leave the viewers so that we could actually discuss this exciting topic.
Yeah, we were going to need a little more time to discuss this in detail, and having covered the history of the disease and some of the controversies at this point, we're going to move on to the situation with the XMRV retrovirus, which was linked to chronic fatigue syndrome in a study published in Science last year, and that is probably the single most important event that we've witnessed, I think, in 25 plus years. It has led to an enormous amount of controversy. It has provided tremendous hope for a lot of patients, but it's complicated. There's a lot to it, and unfortunately, it's just not a simple problem to tackle. So